Um, so super excited to have everyone back. Um, I feel bad. I promised everyone you wouldn't have to hear from me again, other than just introducing things. Um, and then the person that I um, asked to give this presentation, she thankfully made it. She did a great job. She's an awesome presenter, so I feel really bad that you don't get to hear from her. But she had another commitment at the same time, and so she sent me the PowerPoint and um, asked that I give it. So unfortunately, you're stuck with me for another week. Hopefully that won't happen again. But I am really excited about this presentation. It's a topic that is exciting to talk about when it comes to stigma reduction. It kind of, for me at least, it helps link, um, the information that we have about substance use disorder um, and some of the impacts that it can have on people. It just leads to better understanding, which, as we talked about last week, is what really lowers stigma, is increasing our understanding of something, and in this case of substance use disorder. And so this is just, connecting the dots, exploring the link between ACEs and substance use disorder. And we're going to talk a little bit about what ACEs are. An ACE score is, so ACEs are adverse childhood experiences. And so these can be experiences that, before the first 18 years of life is what they look at. And these are experiences that can lead to trauma. And so there's all of these different categories. And so a score of 0 on this questionnaire that they give means that a person has no exposure to the trauma. A score of 9 would mean that they have exposure to all of the categories. And so this questionnaire that they give out to find ACE scores, it's got questions related to physical abuse, emotional abuse, sexual abuse, drug abuse, substance abuse, a family member or a household member who's incarcerated, someone who is chronically depressed, mentally ill, institutionalized, or suicidal, violence towards the mother or mother figure, one or no parents in the home, and then emotional or physical neglect. And so you can see sort of an example, a sample of the questionnaire that they might give, where it asks questions about that. I would encourage you, if you have an interest in this, I would encourage you to go seek out an ACEs questionnaire. You can find them online and you can take them, and it gives you the resources there. But I would encourage you to go see if this is something that you're interested in. This example here is one that you can find. But to really introduce ACEs, there's a great video that I'd like to show. I tested it to make sure the audio works. I know on Zoom, sometimes that's tricky. I tested it. Hopefully it'll come through okay, but we'll watch this video real quick to introduce ACEs and their impact.
A child's experiences early in life are important building blocks for the developing brain. Genes, nature, are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development. Safe, stable, and nurturing relationships early in life lead to healthy development. But children's brains capture other experiences as well. Stressful events. However, not all stress is bad. Positive stress involves normal childhood experiences, like starting daycare or meeting a new person for the first time. This stress is essential for healthy development because it helps children develop coping skills and confidence. But when stress is frequent, chronic, and uncontrolled, it is toxic to children, especially when they do not have a caregiver to provide support or buffer the stress. Adverse childhood experiences, ACEs, such as abuse, neglect, exposure to intimate partner violence, parental depression or addiction, and poverty, are toxic stressors which could lead to lifelong changes in learning and behavior. ACEs early in development can impact social, emotional, and cognitive functioning, increased risk-taking behavior such as drinking and substance use, and increased risk of disease, disability, and social problems later in life. The question is, how do adverse childhood experiences impact a lifelong development? One of the most important systems in our body is our stress system. It's activated when we experience stress. We become alert, our heart rate increases, and so do our stress hormone levels, cortisol and adrenaline. Our body is ready to react, what is known as fight or flight. A short period of time after the stress is over, or if a child receives support from a caregiver, the stress response turns off and the body returns to a normal state. Adverse childhood experiences create stress responses that stay active, and without the support of a caregiver, the system has difficulty shutting off completely. This constant and prolonged activation can affect immune system functioning and increase the chances of sickness, infection, and disease. Prolonged activation of stress hormones is also toxic to the brain. Certain areas of the brain are more vulnerable to toxic stress, including the executive center or the brain's control center, an area important for solving complex problems, attention, reasoning, impulsivity, inhibition, and learning. A second area is the emotional center, the brain's alarm system, which is involved in processing and interpreting emotions and the ability to control impulses. The third area is the memory and learning center, the brain's filing cabinet, which plays a major role in learning and the formation and retrieval of memories. Science shows that adverse childhood experiences impact all of these brain centers. Behaviorally, what we begin to see is emotional distress, poor emotion regulation, greater impulsivity, learning difficulties, and physical and mental health problems. More recently, science has begun to look at how ACEs cause changes in gene expression through a process called epigenetics, which helps us understand how nature and nurture interact. Epigenetics causes changes in the way genes work without changing the DNA code itself. This occurs through chemical changes influencing how the code is used. In other words, genes are like the hardware in a computer. They determine the boundaries of what is possible. However, we need an operating system to tell the hardware what to do. Epigenetics is like the operating system directing the function of a gene's DNA hardware. The genes we are born with are the genes that we have for life, but experiences like nutrition, exercise, smoking, stressors, and relationships all affect our biology. Adverse childhood experiences are associated with epigenetic changes related to stress, brain development, cognition, and systems associated with mental and physical health. Changes that happen early in brain development are more likely to be enduring and are possibly passed on to future generations as well. The good news is that positive, supportive relationships at any stage in life can make a difference. However, supporting families and children early on will help prevent many of these negative outcomes. One of the key ingredients for healthy development is having warm, loving, and actively engaged caregivers. This involves promoting serve and return interactions, where caregivers actively and warmly engage with the child, making eye contact, responding to sounds, words, gestures, emotional needs, and sharing experiences like reading and play. Providing programs that support caregivers to strengthen these abilities are the blocks that build healthy foundations for life.
And so I think that gives a really good summary of these experiences that we have, and how they can affect us. You hear the argument between nature and nurture in development. The reality is it's some of both, right? Our genetics provide the blueprint for brain development, right? We're coded to develop a certain way, but then the environmental influences shape how we develop by determining which brain connections are strengthened or weakened. Safe and nurturing early relationships contribute to healthy development, while adverse childhood experiences like abuse and neglect can have lifelong consequences. ACEs activate the stress system, um, which, when prolonged and unsupported, can harm immune system function and impact specific brain areas for crucial problem solving, emotional regulation, memory, things like that. Epigenetics play a role in how genes function, and experiences, including ACEs, can affect gene expression. Fortunately, positive relationships with caregivers can mitigate these effects and promote healthy development, emphasizing the importance of early support and nurturing interactions. Um, and so this is this talks a little bit about the long-term impact of these adverse childhood experiences. In a study from Kaiser Permanente, they conducted extensive research to shed light on specific health consequences of ACEs and their far-reaching effects on individuals throughout their lives. It's the largest study of its kind to examine the health, social, and economic effects of ACEs over the lifespan. There were over 17,000 participants, and they examined past history of abuse, family dysfunction, and current health status. What they found is that as the number of ACEs increases, so does the risk of negative health outcomes. This was groundbreaking as we delve deeper into the consequences of adverse childhood experiences. It becomes evident that a child growing up in an environment marked by abuse, neglect, household dysfunction is essentially immersed in what can be described as a toxic culture. This term aptly encapsulates the detrimental impact of ACEs on a child's development and underscores the critical need for intervention and support to break the cycle of damaging environments. So this is an example of a toxic culture. So this is an example used by Dr. Gabor Mate. Dr. Mate employs a compelling analogy involving a petri dish to help us grasp the essence of our current societal environment. When we study microorganisms in a lab, we cultivate them in a nourishing broth, referred to as a culture medium. If the organisms in this culture medium are dying off, not thriving, or falling ill in significant numbers, we labeled it a toxic culture. Similarly, when we observe increasing rates of sickness, addiction, mental illness, self-harm, overdoses in a society like ours, it becomes representative of a toxic culture, one that does not support healthy human growth. This type of culture can have a permanent impact on the developing brain, leading to changes in its structure and function that can impact cognitive, emotional, and behavioral regulation. This can lead to difficulties with attention, memory, learning, and self-regulation. The impact of this trauma can be felt many years later. There is a traumatic imprint, and when it acts up, the rational part of the brain goes offline. Because of this, the irrational brain and its traumatic imprint takes over. Injured people react to the trauma response in different ways. ACEs can also lead to difficulties with emotional regulation, making it harder for children to regulate their emotions and respond to stress in a healthy way. This can lead to problems with anxiety, depression, and other mental health challenges. Research has shown that the effects of ACEs can be cumulative, meaning that the more ACEs a person experiences, the greater the impact on their health and well-being. For example, who have experienced 4 or more ACEs that are at higher risk for a range of negative outcomes, including chronic health conditions, mental health problems, substance use disorder, and even premature death. When children experience trauma, it can disrupt their sense of safety and security and activate their body's stress response system. Over time, this chronic activation of the stress response system can lead to a range of negative physical, emotional, and cognitive outcomes, including impaired brain development, poor academic achievement, and increased risk of chronic health problems. Toxic stress can also be passed from generation to generation. So it doesn't just stop with the person, right? It can carry on through the generations. When parents or caregivers experience ACEs themselves, it can affect their ability to provide safe, stable, and nurturing environments for their own children, and can contribute to a cycle of trauma and adversity that can be difficult to break. For example, parents who have experienced abuse or neglect themselves may struggle to form healthy relationships with their children, or may have difficulty regulating their own emotions and behavior, which can contribute to a stressful home environment. So we talk about generational trauma, right? Sort of the cycle of trauma, and so these traumatic experiences don't just impact one person, but they can impact generations. Um, in addition, ACEs can impact the way that genes are expressed. Um, and can lead to epigenetic changes that can be passed down from generation to generation. This means that the effects of ACEs can be felt not just by the individual who experiences them, but also by their children and grandchildren. And so these are some numbers coming up, or some data coming up about Utah, and specifically rural Utah, in comparison with the national average. Unfortunately, we're not doing too hot. Children in rural areas are often at increased risk for exposure to ACEs and other forms of childhood trauma. This can include exposure to poverty, poor living conditions, limited access to healthcare and social services, sort of those social determinants of health. We know that in rural areas, those social determinants can be difficult, adverse to the growth of and development of these children. Additionally, rural communities may have limited resource for addressing and preventing childhood trauma, and that can lead to higher childhood or higher ACE scores through childhood. The national average is significantly lower than the ACE score of rural Utah, which is 4.79. Rural Utah adolescents are more likely to experience multiple ACEs than the national average due to poverty levels in rural counties. And these findings highlight the need for targeted interventions to address the impact of ACEs in rural Utah. The most common ACEs experienced by adults in Utah, so this is during their childhood, remember, but these are adults that reported it. The most common by quite a margin was emotional abuse, with 36.9% indicating a parent or adult in the home had sworn at them, insulted them, or put them down before the age of 18. The next most prevalent ACE in Utah was household substance abuse. That was reported by 23% of adults, and household illness, mental illness, was reported by 22.3% of adults. So yeah, here are the numbers again. You can see 22.2% had experienced a divorce or separation of their parents, 19% experienced physical abuse, 15% witnessed domestic violence, 13% experienced sexual abuse, and then 7.7% experienced an incarcerated family member or household member. And so this is sort of on the other side of things. These are some of the positive childhood experiences or protective factors you'll hear often in the world of substance use prevention and recovery, risk and protective factors. So we've got our risk factors, and that's what ACEs are, and then we've got our protective factors. So this is just sort of more, of course, self-reflection or questions that may be asked in a recovery setting or in a therapy setting. But how much of or how often during your childhood did you feel able to talk to your family about your feelings, to talk to people around you, to feel your family stood by you during difficult times? Did you enjoy participating in community traditions? Did you feel a sense of belonging in high school? I'd even take that a step further and talk about with the developing brain, um, junior high or middle school. Um, and in rural Utah, we often see that you go straight from sort of the elementary school to the high school. Of course, those age ranges are wider, but did you feel a sense of belonging in sort of the developing teenage years? Did you feel supported by your friends? Did you have two non-parent adults who took genuine interest in you? And did you feel safe and protected by an adult in your home? So those are just a few questions that address some of the protective factors that we can look at. What are our protective factors? These are the five, or at least five of them that are impactful when it comes to the inverse of our ACEs. We've got parental resilience. So when parents are able to cope with stress and challenges, they're able to deal with their own stress and therefore support other people and especially their children during times of stress. Social and emotional competence of children. Are children able to regulate their emotions? And we talked earlier about how that can be difficult when they've experienced trauma. It can be difficult for children to regulate their emotions. And so on the other side of that, are they able to do that? Are they able to regulate their emotions and form positive relationships? Social connections. Do you have positive relationships with your family, friends, and community members? Do you feel a sense of belonging? Our relationships really are key. They are our best resource. And so forming those relationships is crucial and can be difficult when trauma is experienced at a young age. Concrete support in times of need. That's access to resources outside of our relationships, food, housing, healthcare, mental health services, some of those basic needs that people need in order to live a healthy life. Knowledge of parenting and child development. So, the ability to go above and beyond just the baseline to find more information by parents. So being able to cope with stress and challenges. So not just, skimming the surface and ducking above and below water, having the ability to go above and beyond and continue to develop as parents. And so we're going to look at some visual of these concepts. And I want to note here that not all children who experience ACEs will have negative outcomes. And we even see sometimes that they have greater resilience because of their experiences. So this isn't meant to be just a scare meeting. I'm not here to scare you. It is important to note these things. It's important to know some of the effects of childhood trauma. But just because someone experiences childhood trauma doesn't mean that they're destined to a life that's miserable. And in this context, a life of addiction and recovery, substance use. It doesn't mean that they're doomed. So this is a graphic of how things are believed to work. And so this is where the positive childhood experiences, or PCEs, come into play. Positive experiences can help buffer the negative effects of ACEs and promote resilience in children. For example, a supportive caregiver, a safe and stable home environment, or access to educational and extracurricular opportunities can provide a sense of security and stability that can help a child overcome the challenges they may face as a result of their ACEs. The graph aims to show that the quality of a child's relationships with their caregivers and other significant adults in their lives can also play a crucial role in their resilience. Children who have secure attachments with their caregivers, who feel loved and supported, and who have positive role models and mentors in their lives are more likely to develop resilience and overcome adversity. When negative ACEs outweigh positive PCEs, a child's ability to develop resilience may be significantly compromised. The effects of ACEs can accumulate over time, leading to chronic stress and trauma that can have long-lasting effects on a child's physical and emotional health, as well as their ability to form healthy relationships and regulate their emotions. This can lead to negative outcomes such as depression, anxiety, substance abuse, and other health and behavioral problems. Without sufficient positive experiences in relationships, children may struggle to develop coping skills and the ability to overcome adversity, making it difficult to build resilience. Additionally, the absence of positive PCEs may leave a child feeling isolated, unsupported, and unsafe, which can further exacerbate the negative effects of ACEs. Right, and so that's sort of what we see here. We've got our positive supports, they're outweighing the negative experiences, and so the child becomes more and more resilient. Here, the negative experiences are outweighing the positive, and so that their ability to be resilient is decreased. So this is, relative to addiction. The impact of an ACE can persist long after the initial traumatic event has passed, morphing into a variety of negative health outcomes. In addition to various mental and physical health ailments, an ACE can also lead to addiction in adulthood. Individuals who have experienced some form of childhood trauma have shown an increased tendency to abuse drugs and alcohol. Higher ACE scores were linked to an increase in smoking, as there was a 250% increase in an individual with an ACE score of 6 or more when compared to a person with an ACE score of 0. The same was true for chronic alcohol abuse, as there was a 500% increase in adult alcoholism with an ACE score of 4 or more compared with a score of 0. Shockingly, one of the highest increases was seen in the category of injected drug use. According to the NIH, the National Institute of Health, a male child with an ACE score of 6 has a 4,600% increase in the likelihood of using IV drugs compared with a score of 0. So that's a huge number, right? 4,600% more likely. That is just sort of astronomical. So we see that there, in relation to substance use, to addiction, these adverse childhood experiences really are something that we need to keep an eye on, and something that can explain a person's aptitude to use and then to become addicted. So we talked about how addiction is a disease, and while people may choose to use the first time, they may not choose, or they do not choose. It's a disease, right? They do not choose that addiction, and so it's one of those things that we've got to keep an eye on with stigma, that there are a lot of factors that can contribute to addiction and to disease and to substance use disorder, right? It's not just a person's choices that make them fall into addiction. And there's a video here. I don't know if it's going to work, so I'll probably just explain it. But this is a screenshot of the guy. He's got 2 lighters, right? So he lights them, and that's what people see. But then he puts the lighter in one of the lighters in the base and starts filling it with water. And as it fills, it adds different things. So, right. So abuse. We talked about these factors. We've got abuse, we've got drug use in the home, abuse not just of the child, but of the parent, and especially the mother, having an incarcerated member of the household, single parent homes, neglect. And so we see these things that people experience, and so he covers the lighter with water. And of course, we know if a lighter becomes waterlogged, it's no longer able to ignite. And so it's important in relation to substance use and substance addiction that we understand that. that we're looking at an individual's whole life when we're looking at, even if it's just for a small period of time, we have to take a holistic approach in order to understand some of the factors that may have led to substance use disorder. Normally at this time, I would open it up to questions. Like I mentioned at the beginning, am not an expert on these. I've got what I have in the presentation, I've got in front of me, and I've been around Jen, who made the presentation, enough to sort of know the very basics. But I would encourage you, if you have questions, to reach out to Jen. Her contact number is on the screen. She's happy to answer questions that may come up. She is a nurse by trade, and has worked in substance use recovery and clinics for a long time. And so I would encourage you to reach out to her with any questions that you may have. But I guess if anyone has a question that they think they would like to ask now, I'm happy to answer those. I am going to take that as a good sign. So I am going to go ahead and we will cut this short again. I mentioned I'm a fan of shorter meetings, and so we will go with this. But we'll be back next week, same time. And again, would invite you, if there's anyone that you think would benefit from this sort of webinar, we'll have the recordings of the first 2 sessions up on our website. And also invite them to register. It's never too late. We're happy to invite them to the remaining sessions. Of course, we've still got 6 more. And so if anyone you think would benefit, feel free to share with them the registration that you signed up for. We're happy to invite them along for the rest. And so with that, we'll go ahead and close out. We'll see you all next week, and hope you have a great week. And yeah, that's pretty much it. Thanks all for coming. Appreciate you taking time out of your lunch hour to come and join us. So appreciate everyone.